Dr. Nazari, tell us, when it comes to gum surgery, first of all, give us a little bit the 2 or 3 stages of gum surgery or gum cleaning which exist, and how they're getting fixed these days versus maybe 5, 10, and 20 years ago, because I'm sure there have been advances made there also.
Well, as far as the gum treatment is concerned, we can start from regular cleaning all the way to the surgical procedures.
Right.
Regular cleaning is done either by hygienist or a dentist, that they just go ahead and do what we call it supragingival or above the gum area cleaning. Mm-hmm. If there is any little bit of buildup or calculus or tartar around the teeth, it can be sealed off. If the tartar or the buildup travels down the root inside the gum, then the dentist have to clean it, what we call it, by deep cleaning or scaling and root planing. They have to go and then with special instruments to remove all the tartar from the gum. And these days there are antibiotics available that the dentist or hygienist, they can place at those sites to kill all the bacteria to prevent the gum disease from spreading further down. If it comes to the point that those do not work, then they have to do what we call it gum surgery. It means that they have to go ahead and remove some of the gum areas around those areas that have been unfortunately neglected for a long time, and to get rid of all the bad and dead tissue. And usually after the surgery, the patients would have what we call the root sensitivity, which again we have medications for it that we can apply to the root directly to decrease the sensitivity that the patients would have. And also there are laser machines available that they can go ahead and kill all the bacteria and the germs in those pockets around the gum, so the gum can heal faster and better without actually doing the surgery. It all depends on the clinical situations, that also depends to the dentist's recommendation for that specific patient.
So if a person does a laser surgery, cleaning the gums, cleaning the bacteria, the germs, that flesh-eating bacteria, as I call them, they may not be technically flesh-eating things, but in any case, does he still then need the knife? Do you still then need to cut the gums, or is it sometimes a combination of it, a little bit of this, a little bit of that, or?
It can be a combination. It can be sometimes you don't need it, and sometimes you need it. It all depends to the clinical situation and then the recommendation of the 3D dentist.
Mm-hmm. Okay. Now, since we're talking about this subject, let me ask you something. I mean, every dentist says that when you get this gum disease, which progresses sometimes fast, meaning a year or two, sometimes takes 4 or 5, whatever years to get to that last stage, you will lose your teeth. And that's, of course, a bad thing. But we also talked about how good your dentists are in putting in implants, even dentures or whatever. And yes, it costs money and all that stuff. But it's, at the very least, it can be done. You can still look good. And 99% of the people, except maybe a dentist, will never notice that you have fake teeth in it. Now, that said, if you have a disease you have an infection, you have that yellow, reddish, ugly pus right in your mouth, right at the gateway of the blood vessels. Nothing is more gateway to the blood vessel than your mouth. Would you agree?
Yes.
So you have that infection there. You have that, if you have an infection on your tiny finger, or if you have an ingrown toenail, you run to the doctor. Correctly so. But you apparently don't do it here. Now let me ask you, losing the teeth aside, bad thing, no doubt, costly, all kinds of things. But wouldn't a person during this 1 to 5 to 6, maybe 10 years, whatever it takes to come to this point, wouldn't he poison on a daily basis his body? Wouldn't he poison his kidney, his liver, his blood, clog up the blood in the arteries because of it, get heart disease and strokes and and a liver failure, kidney failure, the immune system comes down. Haven't there been people, women diagnosed or not diagnosed, physically gotten premature babies because of all that stuff? Isn't that the truth? And wouldn't, if that is the truth, be that particular damage so much more irreversible, so worse than losing the teeth? Because at least we can replace them. But how are you going to replace your kidney, your liver? How are you going to live with 5-10 years of lowered immune system, getting the flu faster, being more fatigued and all that stuff? I mean, I could go on and on. It's just unbelievable if this is true. So tell us, how far off am I with what I just said?
Well, absolutely. You are very, very aware of this matter. There have been studies, there have been published studies, that there have been in many news outlets also, that there's a correlation between the health of the mouth and also the organ system that you just mentioned. Especially in the past few years, you can hear it on probably a monthly basis, the relationship between the heart disease, heart attacks, and also the periodontal disease, or we call it advanced gum and bone disease of the mouth. And then you are right. I mean, this is an infection. It can be systematic infection. It can get into the system, and it can affect any organ in the body. Because just like that, you get the infection on your toe and can spread to the rest of your body. You can have the same infection inside the mouth, which can spread to the rest of your body, and then they cause severe ailment and disease. And the good thing about oral cavity is that the immune system in the mouth, it can control it up to a certain point. It's not as fast spreading as like infection that you get in the toe or in the finger. So that's what people think that it's not going to happen, but it's going to happen sooner or later. And there are studies to support what you just mentioned.
I see. So basically what you're saying, that your oral inside the mouth, be it the saliva or whatever it may be, fights the infection a little more than if you would have it somewhere else on the body, but that is no reason that it doesn't have to fight it. It's like with the wars. We have 2 wars going on now in this country. How many more wars can we have? Because all the soldiers are there on those 2. So if there's a country really attacking us now, like the little Austrian guys, where I come from, if they all of a sudden decide to take back America, how are we going to fight them? Because we're somewhere else. And the same with the immune system. It's if all your immune system, the free radicals and everything has to fight this in the mouth, it cannot fight the flu and the other things anymore, and then you're more susceptible to it, right?
Definitely. You cannot be ignoring or neglecting your mouth, because it's a slowly progressing disease. In susceptible patients, it can cause very, very dangerous effects as far as getting heart attack down, affecting the kidneys, the liver, or any other organ in the body.
So it is basically a slow, a slow dying kind of, even if it's maybe not dying, but, definitely a diminished, who wants to have a bigger immune system when the next flu season comes? And it will come to all of us. Be it spring, be it fall, it's going to come. It doesn't have to be the swine flu or the bird flu, just the normal flu season, or the everyday fatigue, that type of stuff. I mean, who wants that? Who wants the liver to work a little less good than it could? It's already difficult to make it happening with all the food we're eating, but, eliminate what you can eliminate. Looks to me like it's a really, maybe there's lots of people out there who would be feeling a lot better if they get their gum problems handled.
Definitely. Also, if you have gum disease and then the teeth are loose and wobbling, it's harder for the patients to chew. It's harder for them to receive the quality nutritional and nutrition and then the diet that they need. So that can suppress the immune system also. That can lower the immune system too. That would lead to other, systemic, diseases.
Right. And of course, in most cases, there probably, no matter what, is also bad breath associated with it. Bad breath, which is really kind of bad breath and just cannot be taken away with any brushing and with any chew gum. It's there because it's in your flesh.
Definitely. And that's a very big turnoff.
I'd say so. Well, Dr. Nazari, thanks for shedding light on, some very, very important issues. And as we can see, a dentist, it really, the mouth affects everything. I mean, you have mentioned in one video where you could be getting neck and shoulder pain, even headaches if your mouth isn't aligned because of missing teeth. We know that you can have a fallen in, caved in, not good looking face because your bones are shrinking. Now you can have a higher immune system, a lowered immune system and more other illnesses. So I think a dentist is overall underappreciated in terms of like how heavy it affects the rest of the body.
Well, unfortunately, it's because of the lack of proper dental education. If a patient is educated about their oral, about their mouth and then their teeth, they would come to appreciate their mouth, their teeth, and also appreciate the people who care for them, which are the dentists.
Right. Well, let's hope that this video does its part, Dr. Nazari. Bye-bye.
We hope so. We hope so.